Highway to Health. Learning about disease, symptoms and signs of diseases, some very common diseases affecting human beings, and prevention of infectious diseases. Disease. Disease, as the word suggests, means dis-ease or not at ease or departure from health. Disease is a condition of the body in which the vital functions are disturbed physiologically or psychologically. Specific symptoms and signs are associated with each disease. The point of entry of the pathogens and its target tissue in the body may not be same. For example, hepatitis virus enters through the mouth and produces disease in the liver. Poliovirus enters through the mouth and affects the nervous system. Symptoms and signs of diseases. Symptoms of the disease are the changes in the body that makes one feel sick or unwell. It is a feeling which is noticed by the patient, indicating the presence of disease or abnormality. Symptoms does not pinpoint what the disease is. For example, headache may mean examination stress, an eye defect or a tumor or a symptom of any of a dozen of other diseases. Symptoms cannot be verified or measured. They are subjective to a particular patient. For example, aches and pain, itching, cough, cold, etc. Signs of a disease are what the medical practitioners look for on the basis of the symptoms. Signs of a disease can be verified or measured by a doctor, hence they are objective. For example, blood pressure, pulse rate, etc. The symptoms depend upon the target of the pathogens in the human body. For example, when liver is the target, there is jaundice. When lungs are the target, the symptoms are cough and breathlessness. Some of the effects are due to the body's immune system, which fights off the disease-producing microbes. Because of infection, immune system is activated and sends many soldier cells to the affected tissue to kill the microbes. This causes inflammation, which leads to local effects like swelling and pain and general effect such as fever. To confirm the disease, doctors then carry out confirmatory tests like laboratory test of blood, urine, stool or even an X-ray. Some very common diseases affecting human beings are given below: typhoid, malaria, diabetes, common cold, tuberculosis, hepatitis and polio. Typhoid. Typhoid is an infectious waterborne and foodborne disease. Malaria. Malaria is a disease transmitted through a vector mosquito. Diabetes. Diabetes is a hereditary disease and it is not a communicable disease. Common cold. Common cold is an airborne infectious disease caused by virus. Tuberculosis. Tuberculosis is also an airborne communicable disease but caused by bacteria. Hepatitis and polio. Hepatitis and polio are both viral diseases caused by contaminated water or food. Diseases can be broadly classified in two different ways. Types based on the time for which the disease lasts. Chronic disease. Disease that lasts for a long time, sometimes even for a lifetime, is called a chronic diseases. For example, diabetes and tuberculosis. Acute disease. Disease that lasts for a shorter duration is an acute disease. As it gets cured fast, it does not get time to cause major damage to the general health of the person. For example, common cold. Endemic. Disease is found in a certain area, attacking fewer people. For example, filariasis is the endemic in the 3 districts of Kerala: Kottayam, Alappuzha, Ernakulam. Epidemic. Disease spreads from place to place, affecting large number of people. For example, typhoid epidemic can spread during a pilgrimage. Pandemic. Disease spreads worldwide. For example, AIDS. In the following table, we see the diseases, their duration and efficacy. Types based on the cause of the disease. Disease caused due to the infection agent or pathogens is called communicable or infectious diseases. They are caused due to microbes like bacteria, fungi, virus, protozoa or helminths, etc. These diseases spread quickly and widely where good community health is not maintained. For example, influenza, amoebic dysentery, etc. Disease which is caused due to internal non-infectious reason is called non-communicable or non-infectious disease. Such a disease is restricted to the person who is affected. For example, genetic abnormalities, wearing out of tissues, for example, arthritis or deficiency diseases, for example, night blindness and degenerative diseases. Stephen William Hawking is a well-known British theoretical physicist. His work on black holes, theoretical cosmology and quantum gravity is appreciated all over the world. In his late 20s, he started developing symptoms of amyotrophic lateral sclerosis, a kind of neuromuscular dystrophy which almost completely paralyzed him. He went on to complete his doctorate in the same condition. In 1985, he caught pneumonia and underwent tracheotomy which made him unable to speak. A Cambridge scientist built a device that enables him to write on